I think what people need to know too, and I touched on this, but I think what people need to know is that it is not just, people living on the street who've been attacked by addiction. It's so much bigger than that. And there's documentaries now, like The Truth has come to light, right? When you watch series like Dopesick, and somebody in our trades, they got hurt at work, and they go to the doctor and they're prescribed this medicine that is supposed to help them. And they end up becoming completely dependent, so physiologically dependent on this drug that they can't function without it. Like, it is very challenging to describe to people how the body's dependence on these drugs. And I think once they understand that, they realize this isn't a choice. Like, they feel like they will die if they don't have it. And they will do anything to get it. Anything. They've almost left their body and become another person. And hence you have a rise in crime. Hence you have a rise in chaos, because nothing else matters except getting that next drug. And here's the real awful, mean, horrendous part of addiction. The more you take, the higher your tolerance is. So you need more and more and more and more. And you need medical intervention to get off of this. You cannot do this on your own. In fact, withdrawal, in many instances, you can die if you're not supervised. But we have a government that, tell me where your local treatment and recovery facility is. I'd love to hear it. Oh, you can't. You can tell me where your local CTS is. And that's a rung on the ladder. And I get it, you gotta build trust. But the second those people want access to treatment and recovery, sorry, but we care about you. That is complete hypocrisy. It is absolute hypocrisy. There are families that I've dealt with in my own riding, they've asked for help. If you were having a cardiac arrest and you phoned the hospital, they would get you in right now. I have mental illness, I have an addiction, sorry, it's a 3-week wait. Sometimes it's a 3-month, sometimes it's an 18-month wait. But if you were having a heart attack, yeah, come on in right now. People are dying waiting because we don't have a national plan and we don't have a government that has any plan in place other than to throw more money at more drugs. It makes no sense. We are missing common sense in this discussion. We can do so much better. In 7 years, 38,514 lives were taken. Here in Ottawa, where I sit right now, almost 600 people have died from overdose since 2018. That's the nation's capital, just down the street, literally walking distance from the Prime Minister's office and a 5-minute drive from his cottage. A number that's a fraction of how many people are impacted or died as a result of addiction. That number is shocking enough in itself. That's 21 people a day dying from overdose. But that number doesn't even account for the amount of people who are dying as a result of complications due to addiction. Maybe it's an infection, maybe it's a heart condition, maybe they are starving and homeless, or who knows that real number. If that's happening in the nation's capital and the Prime Minister doesn't know about it or understand it or isn't willing to change what he's doing, what's happening across this country? And that number is not even reflective of the people who are dying, not from overdoses, but from complications from toxic drugs. This is one of the worst diseases our time has ever seen. The Trudeau Liberal NDP coalition has done a failed experiment. They've ruined people's lives. They keep doing the same thing and expecting different results, and yet the death rate goes up and up and up. Why? Because people don't need access to safe supply. They need access to treatment and recovery as soon as they need it. Do you know what else that number, 38,514, doesn't include? the irreversible damaging impacts on friends and family. How many mothers, fathers, sisters, brothers, friends are sitting at home right now? They don't even know where the person they once knew is because they're stuck in addiction. And don't think that this is just people living on the street. If we don't change course, more innocent lives are going to be lost. We need access to treatment and recovery. We need to stop using marketing slogans like safe supply. It is not compassionate to enable people. It is compassionate to tell people that they are worth saving and that they are valuable and they have a place in this world. That is leadership. You are valuable. Drugs have taken you and are holding you hostage. They're holding your family hostage. You are valuable, you have a place, and the government will invest in you. These are not just feelings and opinions, these are facts. Listen to this statistic, and if it doesn't shake you to your core, if it doesn't propel you to get involved, stand up, and change your vote, I'm not sure what will. Listen to this. The number one cause of death in children aged 10 to 18 in British Columbia is opioids. 10 years old. What 10-year-old is accessing safe supply? These are stories we're being told to help us feel better, that we're doing something. Nothing is being done. Because if something was being done, these numbers wouldn't be going up, they'd be going down. People would be living drug-free. They would be living a life of recovery. 10 to 18. If that doesn't shock you. If you talk to first responders, they will tell you sometimes in one shift they will get 4 calls to the same person who has overdosed. It is difficult to explain how big this is. And it's an experiment. Addiction is a disease. It is not a choice. People need access to timely treatment and recovery. When they decide they are ready, they need access like that. This government has failed them. There is no access to timely treatment and recovery. There is money being thrown at safe supply, and it is not working. It doesn't matter what your socioeconomic class is. It doesn't matter what your gender is. It doesn't care. And you have very vulnerable children who have access to technology that our generation never had access to. And they're being sold stories that there's safe supply. What a terrible, terrible term to tell somebody. What is safe about it? There's nothing safe in it. It's drugs, it's toxic. I think people have to really start questioning what they thought they knew. And I think that's a very challenging thing for people to do. I think it's really, really challenging. And I think you can read all the statistics you want, but I think anybody who goes down to their downtown core will see the result of a failed experiment. They're absolutely catastrophic, and it impacts the downtown business core. It impacts families not feeling safe in their own community. It's destroying and eroding families at the core. Inflation is sky high. The cost of living is sky high. People are turning to drugs because they can't cope, right? The stress of living. There is a direct link between the cost of living crisis and affordability and addiction and mental health. Those two things do not live in separate worlds, right? You need to be able to cope. There is nothing more inhumane than watching somebody suffer and nobody helping them. It's like when you go downtown, and East Hastings is something that every person in this country should see, but sadly they're starting to see it in their own community. But East Hastings is a region in British Columbia, and it has gotten progressively worse. And to see people discarded like garbage, literally, on the side of the street, slumped over, some of them are deceased, honestly. Like, it is that grave. And it is so inhumane to leave people there. It is 100% fine to meet people where they're at. That's completely understandable. But to leave them there in that is the most inhumane thing we can do as government officials. I think people think they're helping. I genuinely think people think they're helping because it's so emotional, but it's not working. It's just not working. Like, you have to change what you're doing. You can't keep doing the same thing and expecting something different. And the number of people suffering is not getting smaller, it's getting bigger. You have to change what you're doing. And we're the only party offering to do that. So, addiction is not a separate issue from all of the other issues, right? We have a housing crisis, you have an affordability crisis, you have crime, chaos. They're all one. They're all shared and connected by the same lack of leadership, quite frankly. But one of the biggest issues, obviously, is our healthcare. We have outrageous wait times, right? When you need help now. And it takes an incredible amount of courage to ask for help, especially when you're dealing with addiction that has so much shame and stigma attached to it. But one of the things that Conservatives have promised to do, and our leader Pierre Poilievre, is do the Blue Seal program. So you have all of these doctors, nurses, healthcare professionals who've immigrated here, who are ready, qualified, and so want to work, and they can't because of bureaucracy, because it's so challenging to practice here. There's a running joke in this country: if you need a doctor, call an Uber. So that's another issue. So if we have more working healthcare professionals, if we have more access to doctors, that's also going to be a massive help in addiction and treatment and recovery, right? It's a big, big missing piece of the puzzle because there's just not the frontline staff there to help when help is needed. Right now, nobody has the freedom to make their decisions of their life. They go to work, but they're penalized. They don't even get to bring home their paycheck. And so why go to work? Every single human needs to know they're valuable, needs to know they're valued. When we can't go to work, when we can't get a job, when we don't know where we fit, but when we do, or if we do go to work and half of that money is taken from us, or we have to take a second or a third or a fourth job, and we no longer can go to our kids' birthday parties or our grandkids' birthday parties, or we have to sell our house and live in our car, or ask our kids if we can move in with them, and we're supposed to be retired and living the best years of our life, that is causing mental health crises across this country. It's also burdening our healthcare system that already has massive wait times because now people can't cope. It is an absolute snowball impact when you have a government who doesn't care about monetary policy or doesn't worry about balancing budgets. Because if you can't afford the basics of life, that is catastrophic. It is absolutely catastrophic. And there's no incentive. Like, you have young people who are feeling hopeless. Why would I even go to work? What does it even matter? I'm never gonna afford a home. If you don't have things to look forward to, I'll give you this analogy. Vacationing or trips are important, but what's more important than the actual trip or vacation is planning the trip, knowing you have a trip to go on. That gets you through the day, right? You're having a hard day at work, life is hard. Well, I know I have this to look forward to. Right now, Canadians have nothing to look forward to. And it is absolutely destroying their mental health. This doesn't have to be an irreversible tragedy. This is fixable. Science is there. We know we can change this. You can't keep doing the same thing and expect different results. Canadians expect us to be a country where every life is valued and everyone struggling with addiction has a chance to find their way back. Their families deserve that.